Hey there. If you're going through pelvic radiation, or you're about to, you know that managing side effects is a huge part of the whole journey. Today, we're going to zero in on a really common one: urinary symptoms. Our goal here is pretty simple: to give you clear, practical info so you can feel like you're back in the driver's seat. So, have you been noticing some changes? Maybe a new sense of urgency, or you're running to the bathroom way more often, or maybe it's just uncomfortable. If any of that sounds familiar, I really want you to hear this. You are absolutely not alone. This is super common, and we're about to walk through exactly what's happening and, more importantly, what you can do about it. All right, let's jump in. Here is our game plan. First, we'll get into the why: how radiation actually affects your bladder. Then, we'll map out a typical timeline so you know what to expect. After that, we'll spend most of our time on the good stuff, the practical strategies, starting with things you can do yourself and then what medical support looks like. And we'll wrap up with maybe the most important part: knowing those red flags so you know exactly when to reach out to your healthcare team. So, first things first. To really get a handle on these symptoms, it helps so much to understand why they're happening in the first place. This is the foundation for everything else we're about to talk about.
Okay, you're going to hear these three words thrown around a lot, so let's make sure we're all on the same page. Dysuria. That's just the medical term for that painful or burning feeling. Frequency is pretty straightforward. You feel like you have to go all the time, but maybe not much comes out. And urgency, well, that's that sudden, gotta go right now feeling. These are really the classic signs that your bladder is feeling irritated from the radiation.
Now, this is a really important distinction to understand. The vast majority of what people experience are what we call acute effects. This is basically just inflammation of the bladder lining during or right after treatment. And here's the key takeaway: it's incredibly common and it's usually temporary. Your body just needs time to heal. Chronic effects, on the other hand, are much less common. They can show up months or even years later and are caused by more long-term changes, and they might need a different kind of care. Just knowing what to expect and when can make a world of difference. It can really help take the fear of the unknown out of the equation. So let's look at a general timeline. So here's how it usually plays out. Things often start off pretty mild, maybe around week 2 or 3. Then, the symptoms tend to hit their peak towards the end of your radiation treatment. But, and this is the good news, that first 3 months after treatment is your recovery window. You should start to see things gradually getting better. The really crucial point here is at the bottom. If new symptoms pop up or old ones get worse way down the road, like a year or more later, that's something you definitely need to get checked out. All right, now for my favorite part. This is the empowering stuff. This section is all about what you can do. Simple but really effective strategies that you can start using today to get some relief. Now, this first one might sound a little weird, right? If you're going to the bathroom all the time, why on earth would you drink more? But trust me, this is probably the single most important thing you can do. Drinking lots of water actually dilutes your urine. This makes it less acidic and way less irritating to your bladder. Think of it as flushing the system out. So aim for 6 to 10 glasses a day, unless your doctor has given you different advice. And at the same time you're upping your water intake, it's a great idea to cut back on things that are known to irritate the bladder. This list has all the usual suspects. You don't have to cut them all out forever, but think of it as a little experiment. Try cutting back on your morning coffee or that afternoon soda and just see how you feel. For a lot of people, it makes a huge difference with that urgency and frequency. And here are a few more pro tips. Timed voiding is all about you taking back control. Instead of letting that urgency signal dictate your life, you go on a schedule, say every 2 or 3 hours. It helps retrain your bladder. Simple comfort measures, like a heating pad on your lower belly, can feel amazing when you're having spasms. And finally, when you do go to the bathroom, try to just relax. Take some deep breaths. Straining just makes the irritation worse. So self-care is your first line of defense, and it's super powerful. But hey, sometimes it's just not enough, and that is totally 100% okay. So let's talk about the medical support options your team might bring up if you need that next level of help. This table lays it out really nicely. The treatments are very targeted. So if burning and pain is your main complaint, something called a urinary analgesic, like over-the-counter azo, can really help numb things. For men who might be dealing with a weak stream, an alpha blocker can help relax the muscles down there. And for that constant nagging urgency and frequency, there are bladder relaxant medications that can really help calm things down. Okay, this is so important to remember. Not every urinary symptom you have is automatically from the radiation. A urinary tract infection, a UTI, can look and feel almost exactly the same. So it's essential that your doctor rules this out because if it is a UTI, the fix is often just a simple course of antibiotics. All right, we've reached what is probably the most critical safety information in this whole guide. It's vital to know the difference between symptoms you can manage at home and the red flags that mean you need to pick up the phone and call your care team right away. Please take a really good look at this list. Any of these things, a fever, seeing blood in your urine, literally not being able to go at all, or just severe pain, these are not wait-and-see situations. These require an immediate call to your doctor. And I want to point out that last one too. Even without the other red flags, if your symptoms are so bad that you can't sleep or just can't get through your day, that is absolutely a reason to call. Your team is there to help you. I want this quote to really stick with you because it sums everything up perfectly. You know your body better than anyone. If something feels new, if something is getting worse, it always deserves a conversation with your healthcare team. Please don't ever blow off your own concerns as just the radiation. We have covered a ton of ground, from the why all the way to what you can do about it. So I'll just leave you with this question to think about. What's one small step you can take today to feel more in control? Maybe it's just grabbing an extra glass of water right now. Maybe it's skipping that soda with dinner tonight. Or maybe it's just jotting down a question to ask your doctor at your next visit. Whatever it is, taking that one small step is a really powerful way to put yourself back in charge of your own care. Take good care.